The prescription drug epidemic in America has its claws in our health system. With unlimited access to meds, medical professionals are getting hooked, putting patients at risk. Just how big is this a problem, and what can be done? To discuss, we are joined by Dr. Andrew Kolodny, Chief Medical Officer at the Phoenix House Foundation and the President of Physicians for Responsible Opiate Prescribing. Chris Ortega, whose stepfather has been in a vegetative state since a botched open heart surgery. We're also joined by Michael Kapp, a consumer advocate with Consumer Watchdog, and Dr. Stephen Lloyd, Associate Professor of Medicine at East Tennessee State University, who is a recovering addict to narcotic pain relievers. I want to thank all of you for joining me. Michael, I want to start with you. Help me understand the scope of this problem. First of all, what is drug diversion?
Well, drug diversion is when someone uses prescription drugs that aren't meant for them. And the problem is really magnified in hospitals and doctor offices where medical staff have almost unlimited and unmonitored access to controlled drugs. Indeed, the California Medical Board estimates that almost 1 in 5 doctors suffer from drug or alcohol abuse at some point in their careers. And leading medical safety experts have called for random doctor drug testing and better tracking of controlled substances.
Wow.
In fact, the Inspector General of the Department of Health and Human Services recently wrote in the New York Times about a doctor who injected himself with drugs that were intended to go to his patients. The story would be bad enough if the doctor in question also didn't have hepatitis C, infecting 45 patients and leading to the death of 2 others.
Wow, that's absolutely sad. It's stunning that this is happening. It's even more stunning that it is as common as you just told us. Dr. Kolodny, why is this happening? Help me understand why something like this happens.
We've got an epidemic in the United States today of people who have become addicted to opioid pain medications. And medical professionals are certainly not immune from getting this disease. And this is a disease which the CDC has now ranked as one of the most urgent public health problems that our country is facing.
Part of it seems to me, is about mental health. Part of it is about the physical stress and the emotional stress attached to these types of jobs. Have we failed to accurately address those issues?
You know, I'm not sure that that's the issue. I do think that medical professionals are under a great deal of stress, as are many of us in many different occupations. I think that this is an epidemic that's affecting really many different groups. There are really no boundaries. And is stress a risk factor for becoming addicted to drugs? Probably. But I don't know that medical professionals have the monopoly on stressful jobs.
No, absolutely. I think it's the combination perhaps of the stress, the self-medication, and the access.
Yes.
Yeah, absolutely. Stephen, let me bring you into the conversation because you talk about your own experiences with addiction. How did yours start?
Mine started with simply access. I think I agree with about everything everyone said to this point. Stress had a part of it in my residency. I had access, simply I was around it all the time. And I remember taking the first pill, and it was during my chief resident year. I felt like that, really honestly, at the time, I felt like I'd found a cure for depression and anxiety that I thought I was suffering from. And, from there, my use, spun out of control over the next 3 years.
Wow. And in the process of spinning out of control, to use your language, did you feel as if you had put patients at risk?
That's the scary part. To me, it seemed normal. It didn't seem like I was putting anyone at risk. And, that's the scary part to me today. The gentleman spoke before about random drug screening. I agree with that. I've probably got colleagues across the country that wouldn't agree with that, but I certainly do. That's the problem. And I felt like I was in complete control. I felt like the decisions I made were just fine. The truth of the matter is that I didn't hurt anyone because of the, absolutely wonderful folks that worked around me, that kept me from making mistakes that actually hurt someone.
Chris, you also have personal connections to this vis-a-vis your stepfather. Talk to me about the repercussions of this addiction crisis.
Well, I can tell you that my dad now is in a vegetative state since after his surgery. So repercussions are that I would think that, people are in a position where, look at my dad. no communication. Basically, he's in a vegetative state. We go and see him there, and doesn't communicate, does nothing. And somebody, if a doctor is taking drugs or using alcohol, obviously it's going to impair his judgment. And just as previously stated by the doctor, he was saying that luckily he had a good group of team around him that can help out and basically fix some of the problems that he might have opened up. And I think therein lies the problem.
Help us walk through what happened, because I'm not sure our audience fully understands the source of the complication. So apparently the doctor made some bad choices here.
Well, yeah, I was told by an anonymous caller, supposedly one of the nurses that was there, that the doctor walked out in the middle of my dad's operation. And so he left an assistant to finish the operation. And that's not supposed to take place.
Wow, and his reason for walking out was?
From what I was told, was that he was going to attend a luncheon. That's what I was told.
He was going out to do what?
Attend a luncheon.
To attend a luncheon. Wow.
That's correct.
And this is connected to the issue of addiction.
Well, I didn't find out that he was addicted until I read the Fresno Bee, a local newspaper here, that staff in hospital were aware of his addiction to whether it be alcohol or I believe substance abuse is how they worded it. But
wow.
Yeah, I can't imagine that somebody would, in their position, would cover for this doctor.
This is absolutely stunning to me. And we reached out to the Community Regional Medical Center where your father or stepfather was treated. And although we did not hear from them, they did release a statement to the Fresno Bee. They said, while we can't comment on any ongoing litigation, we have instituted improved safeguards with action plans that have been approved by the state. Community continually trains and searches for ways we can improve our patient care and safety. I think what I find most disturbing is that the doctor who performed your stepfather's surgery is still practicing. Dr. Kalani, I don't see how this could possibly happen. And I don't just mean this case, but I mean the fact that this is even a reality at all in this country.
Yeah, no, I think the fact that a physician who was impaired was permitted to conduct surgery is concerning. In the same way that we expect an airplane pilot to be tested before getting in a cockpit, I think we should have the same expectation of someone who's about to cut us open for surgery. I think there is a failure to properly regulate doctors in some specialties. I have less concerns about a physician going back to work again if they may have been impaired or if they're struggling with the disease of addiction. I think if that physician is in recovery and is being monitored carefully, I think it's quite possible for them to be caring for patients again. Possibly not conducting surgery, but certainly going back to work and caring for people. So I don't know that we should necessarily take a physician's license, but we should make that physician receive treatment if they want to maintain
Absolutely.
A license.
I mean, if we think about addictions in particular as medical problems, it would seem somewhat problematic.
That's right.
For the medical community to take away medical licenses rather than offer medical treatment. I guess part of my concern and question is one of oversight, Dr. Lloyd. How easy is it for that addictions to go unnoticed? How easy was it for you to not be spotted by your colleagues, by your patients, by the community?
Well, first of all, my heart goes out to Chris. That's a really difficult story to really swallow, and I just can't tell you how badly that makes me feel inside. And I'm not a surgeon, but I really can't imagine going through that. In my case, it was relatively easy to go unnoticed. I wasn't a bad guy. I didn't do a lot of yelling and screaming, and I worked a lot. So the folks around me, made excuses for my behavior. I was continually late. I rounded at odd hours. I was, late charting. I had medical records that were not done in a timely manner, and that was a change in my behavior. So there were plenty of telltale signs. Yet the folks around me did not want to intervene because it would supposedly hurt my career. The reality is that it put other folks in danger, mainly my patients, not to mention that it enabled me to go further down the path and potentially lose my own life.
Wow.
And, we're the only profession that I know of that are entrusted with policing ourselves. And so those, the people around Chris's father's surgeon who allowed him to operate, when they knew he was impaired, to me is inexcusable. And, the excuse always is, we're scared that it'll hurt his career. What if we're wrong? But, the consequences to me are just too big to do otherwise, particularly when we have access to such high-quality treatment and aftercare. My life has never been better.
I hear that all the time, Michael. I hear it from law enforcement. I hear it from military. I hear it now in the medical community, where people will say, we're supposed to police ourselves. We're supposed to regulate each other. We're supposed to report bad acts of others and within our respective professions, but we don't do it because we don't want somebody to get jammed up. We don't want someone to get a bad reputation. We don't want something on someone's permanent record. Are we at a point where we can simply say we are incapable of policing each other because of these concerns?
Absolutely. I don't think doctors are able to police one another. There's a very strong code of silence in the medical community with the fear of losing referrals or their job if they report a fellow doctor for substance abuse. But just to give you an example, between 2003 and 2013, the California Medical Board received over 1,000 complaints regarding substance abuse by physicians, but only took formal disciplinary action in 32% of those cases. And then California hospitals have only terminated only about 4% of doctors disciplined for substance abuse. So we see this time and time again that the doctors and medical community, they simply can't police themselves, and there needs to be some kind of formal mechanism outside of the medical community to ensure that patients are safe.
Chris, I hate to make you talk about this more than you already have. I know how painful this is for you, but when people see the connection between what could potentially allegedly be malpractice, between addiction, between abandoning one's job and your father's condition, I have to ask, what's the long-term impact been on your family? I want people to feel how your family feels. What's the impact been on them?
Well, just briefly, the impact, my dad's no longer around. My kids can't have their grandfather around. Functions without my dad. It turns your life upside down. You have to, how else can I word it? You have a member that's no longer part of your family. He's still alive, but he's not responding in any way possible. And, to see my kids when we go visit them and see them how sad they are to see their grandfather in the condition that he was in. He was involved with he would go and watch him play sports and birthday parties and family gatherings, and that's no longer taking place, and that's no longer going to happen anymore. So the ramifications, that ripple goes out a very long ways.
Absolutely. Dr. Kalani, what can we do to begin the work of repairing this beyond just lawsuits? I understand lawsuits are part of it, but what's the long-term strategy here?
That's a great question. I think, again, part of this problem goes well beyond medical professionals. We really do have a national crisis of people who are suffering, especially from opioid addiction, and we have to see that people have access to effective treatment. I think an area here with medical professionals is that we really don't properly regulate them. We wouldn't expect any other industry to self-regulate. There need to be protections put in place, and I think we're failing in many different ways. One important way is that we're failing to address impaired professionals, especially impaired physicians, and we need to do a much better job of identifying these individuals and linking them up with treatment. There really are good treatments especially for professionals. It's a particularly easy group to treat because when you can hold someone's medical license in the balance, that's a very strong motivation to get somebody into treatment and get them compliant with treatment.
Okay, so I get a sense of what the community can do, the broader community and the medical community can do to help. now I want to bring the question to you, Dr. Lloyd. What can individuals do? Like, when did you hit your breaking point? When did you realize that you needed to get help?
Well, I told this story in a recent newspaper article, but I realized I needed to get help rounding in the ICU one day, and with a young lady who came in with a drug overdose the night before, and we were getting ready to put her on a helicopter to a local referral center for a liver transplant. And I work at a teaching hospital, and I asked the residents how many pills she took the night before, and the residents responded and told me the number, and the number that she took was less than the number I was taking on a daily basis.
Wow.
And I literally couldn't put my pen to the paper. And I looked at the residents, and I told them that we were going to dismiss rounds, and I walked into a bathroom nearby and sit in there and cried because I really thought at that point that I was just going to die, that somebody would find me overdosed in a bathroom, and that was going to be it. And luckily,
what were you taking then? Like, how many pills were you taking then?
I'm sorry.
What was the quantity of pills you were taking at the time?
At the time, it was between 75 and 80 Vicodin or oxycodone per day.
Wow.
And I eventually got up to 100, and that's the scary part. With access, the milligrams per day that healthcare professionals can get up to is staggering. And I look at it today, and what I do in my day-to-day job, it's just really unbelievable, the dosage I got up to, and how I didn't overdose is just amazing to me. But
I didn't know that was medically or humanly possible, to be quite honest. The numbers you're telling me are staggering. Before the segment started, I heard 100 and I actually thought it was a typo. That's why I asked you. But wow. Yeah.
No, it was for sure that, and for the longest time, I wouldn't even count because I knew how high it had to be. And it was so scary to me. I went to bed half the night praying that I wouldn't die, and the other half of the night praying that I would. It was so hopeless. And luckily for me, my father intervened on me. With so many people around me seeing that something was obviously wrong, it took my father and my sister to say that Steve, we're scared. You look bad. We think something's wrong. And I immediately said, yes, there is something wrong. I'm dying and I need help. And, it changed my life. And I sit here and listen, and I don't disagree with anything that's been said. We are unable to regulate ourselves. And, we need to do something about that.
And that brings me to one final question for you, Michael. We've heard about sort of how the medical community can respond and even how individuals who are in need of help can help themselves or seek help. But how do patients, the people who are the most trusting, the most vulnerable, who have the most to lose in this and who are the least culpable when their doctor is addicted, how can patients and their families protect themselves? What can they do to keep their eyes open to prevent this from happening, and when it does happen, to take proper recourse?
Unfortunately, this is a problem that's larger than just one patient. Right now, not a single state requires doctor drug testing. But there's actually going to be an initiative on the California ballot this November that would change that. It would make California the first state in the union to require mandatory random drug testing for doctors. It's called the PACK Act, PACKACT.org. And I encourage all the viewers to check in and see and hear all the stories about Chris and the other victims of drunk and dangerous doctors. This is a widespread problem, but we have to do something about it. And this initiative in California is going to be the first step.
Chris, would that be satisfactory to you if doctors were routinely drug tested?
Oh, yeah, definitely. I mean, I'm randomly drug tested at my job, so a doctor in a position that they're in, I definitely feel that they should be drug tested.
Absolutely. Sarita Teresa writes in and says, certain professionals and specialists have a higher risk for misuse and abuse. Again, speaking to the idea that, yeah, we all can be addicts. We all can find ourselves prone to addiction. It's a medical challenge. It's one that the country needs to respond to. But again, access, power, and addiction can lead to a deadly dose for patients. And we're very, very grateful for you all sharing your story and your insight as to how we can fix it. Dr. Kolodny, Cristobal, Dr. Lloyd, and also Michael, thank you so much for joining us. I want you all to stay with us. Keep the comments coming in at HuffPost Live. Also, click the red button to be an on-air guest. The conversation always continues.